First aid. It is the instant care of an injured person or a patient until the arrival of proper medical assistance that will prevent the deterioration of health. How to help an injured person. Make sure that the place is clear of any risk on your life or the injured person. Examine the injured person and the degree of consciousness. Call ambulance 999. Aid the injured person until the arrival of medical assistance. Cases in which first aid results in rescue. Loss of consciousness. How to aid an unconscious person. Follow the ABC steps. A. For airway. Open the airway, raising the chin and tilting the head to the back. If there is suspicion of head or neck injury, push the lower jaw forward without tilting the head. Inspect for any reason for suffocation. B. For breathing. Look at his chest to verify it is rising. Listen to his breath. Examine the air coming out from his mouth, using your cheeks for 10 seconds before deciding if there's a loss of breathing. If there is breathing, put the injured person in a normal position and examine him from time to time. And then, start chest compression exercises in the absence of breathing. C. For circulation. Blood circulation. Make sure to stop any external severe bleeding to ensure blood circulation is closed. And cardiopulmonary resuscitation (CPR) is useful. How to perform cardiopulmonary resuscitation (CPR). Make sure that there are no signs of response from the patient. Make sure that the place is safe for you and the injured. Make sure to lay the injured on his back on a solid and even surface. Sit on your knees beside the injured and call him with a high voice to know whether he has response. Cry for assistance. Contact 999. Open the airway with a head tilt and chin lift maneuver. Check if breathing has stopped for a period that does not exceed 10 seconds. Look, listen, and feel. Perform 30 compressions. Put your palm on the middle of the injured individual's chest. Put the other palm on the first palm. Compress directly, quickly and strongly on the chest, with the rate of 4 to 5 centimeters with each compression. Approximately compress 100 compressions per minute. After each compression, reduce the pressure on the chest to allow it to return to its normal position. Give 2 breaths. Put your mouth on the injured individual's mouth exactly, and close both openings of the nose by your hand. Observe if the chest is rising with each breath. Repeat the process, 30 compressions and 2 breaths until the arrival of medical assistance. The injured gives signs of survival, reaching to a severe case of fatigue that prevents you from continuing the rescue. Bleeding. How to stop bleeding. Direct compression on the place of bleeding. Do not touch the blood directly. How to aid the injured in case of shock. Shock is the decrease in the amount of blood reaching to the brain. Its symptoms are pallor in skin color, cold sweats, pulse acceleration and weakness, low blood pressure. To aid this injured person, raise the 2 feet to help blood circulate to the heart and brain. Nosebleed. Compress firmly on both sides of the nose of the injured for a few minutes as he sits inclined to the front and breathes through the mouth. Burns. Cool the burn immediately with cold water, but not ice-cold water. Cover the burn with a bandage, a dry piece of cloth, or a non-sticky sterilized fabric. Move the injured to the hospital. Eye injuries with chemicals. The eye must be washed with plenty of water as quick as possible, making sure that the injured eye is directed downwards when washing, to avoid the transfer of the chemical material from the injured eye to the uninjured eye. Fractures and sprains. Do not move the injured organ. Fix the injured organ using a splint without trying to return it to its normal position. For sprains, follow the following steps. Relax the injured person and prevent him from using the injured part. Put a bag of ice on the injured area to reduce the swelling and pain. Wrap the injured organ with a bandage for 15 to 30 minutes to reduce the swelling. Raise the injured organ up at 45 degrees.